Hi, my name is Jennifer Bates. I'm a family nurse practitioner student with Maryville University. This is my head-to-toe assessment video for my advanced health assessment class. Brittany has volunteered to be my patient for this head-to-toe video. I've asked her to slip into something more comfortable, and she's emptied her bladder. I've tested her height, weight, and vital signs, and all were within normal limits. Tested her far vision with the Snellen chart and her near vision with the Rosenbaum chart. I've washed my hands and will begin the head-to-toe assessment. Just on general inspection, everything looks nice and normal on visualization. Her skin temperature is nice and warm. She has good skin. Turgor is dry. Looking at her hair distribution, she's got nice thick hair, no balding spots. I'll palpate her scalp for any masses, and to make sure her scalp is moving freely. While I'm doing this, I'm going to assess her lymph nodes. I'm going to do her occipital, and her post-auricular, her pre-auricular, her tonsillary, her submandibular, her submental, her deep cervical and her posterior cervical, her cervical chain, and her supraclavicular. I'm just looking at her facial characteristics. Take your glasses for just a second. Just looking at the facial characteristics, she has nice symmetry. Her ears are nice and even with her eyebrows. She has good hair distribution on the eyebrows and her eyelashes. Palpating her auricles. There's no masses, no tenderness. Palpate her lacrimal apparatus. Open your eyes for me. Her conjunctiva are nice and pink. Her sclera are white with no yellowing. Just look at me. Okay. All right. Now Brittany will do the uncover test. I'm just looking for any abnormalities in your eye movements to note for strabismus. So I want you to cover this and then kind of quickly uncover. Very good. Do the same thing with the other eye. Very good. All right, now we'll test for your peripheral vision. All right, cover this eye for me. And tell me when you see my fingers wiggling. No. No. Okay, do it with the other eye. Yeah. Yeah, very good. All right, with her nose, there's no deviation. Her septum is nice and straight and even. There's no drainage. I'm just going to look in your nose for a second, okay? Her turbinates are nice and pink. There's no edema, no drainage. All right, I want you to go like this, and okay, do the other side for me. Very good. All right, her lips are nice and pink, moist. I want you to open up and say "ah" for me. Stick your tongue out for me. Very good. Gag reflex. Very good. All right. Her teeth are evenly distributed. There's a few fillings. The hard and soft palate are nice and moist. There's no masses under the tongue, no ulcerations. Her gums are nice and pink. Stick your tongue out for me. And the tonsils are present. No redness noted to the back of the throat. All right, we're going to assess your ears. And I did not notice any mouth odor at all. On palpation, there's no masses. Looking at her external canal, no abnormalities. Her ear canal is nice and clear, no cerebrum. Tympanic membrane is nice and pearly gray. And we're going to do the same thing with this one. Ear canal is clear, no cerebrum. Tympanic membrane is nice and pearly gray. And when I tug on your earlobes, does it hurt? Nope. Good. Okay, Brittany, we're going to test some of your cranial nerves. I'm going to ask you to do a few things for me. I want you to clench your teeth. Okay, smile. Stick out your tongue. Puff up your cheeks. Alright, kiss. Shut your eyes. Really tight. Okay, and switch up your forehead for me. Very good. Alright, now I want you to close your eyes and I want you to let me know when you feel the tip of this Q-tip on your face, okay? Alright, with your eyes still closed, I want to test the sensation of your lower extremities, okay? And your upper extremities. Tell me if it's soft or if it's hard. Soft. Hard. Soft. Hard. Hard. Soft. Soft. Hard. Okay? Now I'm going to move on to your looking for any jugular vein distension, which I don't see any. We're going to palpate the carotids one at a time. And we're going to assess for thyroid. Can you swallow for me? Very good. And while we're here, I'm just going to auscultate her carotids and thyroid pancreas. Brittany, we're going to test for range of motion on your shoulders and your neck. Okay, so I want you to side with your neck and shrug your shoulders. Okay, now do it with some resistance. Go ahead. This one, and do your shoulders. All right, we're going to do the same thing with your upper extremities while we're here. Hold them out straight for me. Don't let me push you down. Okay, and I want you to push me down. Very good. Kick your leg out for me. Set your knees. This one. All right, very good. We're going to move on to your lungs. I'm looking at her chest for any abnormalities, any masses that I can palpate. Everything looks fine. There's no accessory muscle use. Her respiratory rate appears regular. I'm going to listen to you. When you feel my stethoscope hit your skin, just take a deep breath for me, okay? Okay, hold your arm out a little for me. Nice deep breath. Again. And hold this one out for me. Nice deep breath. Again. One more time. Very good. I'm going to listen to your back while I'm doing this. When you feel my stethoscope, just take a nice deep breath. Very good. I'm going to go ahead and listen to your heart while we're right here. You can breathe normal. And then we'll listen at the aortic side. Hold on it. Touch point. Tricuspid. And the mitral. Okay, Brittany, I'm going to test tactile premises. So when you feel my hands touch you, then I want you to say 99. And I'm going to feel for the vibration, okay? 99, 99, 99, 99. Put your arms out for me. Okay, 99, 99. Okay, we're going to do the same thing posteriorly. When you feel my hands, just say 99. 99, 99, 99. 99. Okay, I'm just going to percuss. Put your arm up on it. And we'll do the same thing on this side. And move on. Okay. Now I'm going to look for expansion in your lungs just to make sure you have equal expansion. So I'm going to put my hands at around the 10th rib with my thumbs close together, and I'm looking to make sure that your lungs expand equally on both sides. So take a real deep breath for me. Very good. And they expanded nice and equal. All right, the next thing we're going to do is diaphragmatic excursion, and we're just looking for the movement of the diaphragm on inspiration and expiration. So I'm going to ask you to do a few things for me. As I want you to take a really deep breath, and I want you to hold it for me. Okay? Deep breath, hold. Okay, let it out. Nice couple even breaths. And then I'm going to get you to take a deep breath, and I want you to blow it all out. Okay? And hold it. Ready? Deep breath, blow it out, and hold it. Okay, and then we would mark both places, and about 3 to 6 centimeters is normal. Pretty well back here, I'm going to test for any tenderness in your costovertebral angle area. So tell me if this is sore or hurt. No. That? No. Any discomfort in your lower back? No. Okay. All right. Now let's look for some of your pulses. We'll check your pulses and your reflexes next. Okay. So we're going to check your brachial and your radial. We're going to do popliteal, which is behind the knee, your salicius, and posteal. And we're going to do the same thing with this one. Popliteal, your salicius, and posteal. And we're looking for any edema, for swelling, nice skin distribution. She's nice and warm, dry. Okay? Now, for your hearing, this is a tuning fork. So we're going to use it for 2 tests. One is called the Weber test. So I'm going to get the tuning fork and put it in the middle of your head. Okay? You're going to tell me if you hear it in both ears or just one ear. Okay? Both ears. Okay? Now we're going to do what we call a Renee test. And I'm going to put it on your bone right here in the back, the mastoid bone. And I'm going to let you tell me when you stop hearing it, and then I'm going to put it beside your ear and tell me when you stop hearing it there. Okay? Okay, very good. So air conduction is greater than bone conduction. All right, one other hearing test I'm going to do for you is called a whisper test. So I'm going to get behind you, and I'm going to whisper 2 words, and I want you to tell me what they are. Okay? Apple. Baseball. Okay, very good. Okay, I'm going to check your reflexes. All right, so we're going to check your brachial reflex on both sides. And hold your arms out for me. You ready? Okay. And your knee. Just freely have your legs out. And your Achilles tendon. Very good. Alright, so we're going to go ahead and do your abdominal exam. But first, when you stand up, I want to check your thoracic and your lumbar vertebrae, okay? I'm going to have you stand. We're going to move the chair away. I just want you to stand right here. We're looking for nice and even. All right, bend a little bit for me. Bend over. And nice and rounded there. Okay, very good. And your back. There's no unfun visualization. There's no problem areas. Okay, have it lay down for me. So the first thing we're going to do is inspect the abdomen. So we'll get down at the level of the abdomen, just looking for any abnormalities or any masses that there might be. I don't see anything, so we'll move to auscultation. So we're going to listen to all 4 quadrants. If I didn't hear anything, I would listen for at least 3 to 5 minutes. to verify absent bowel sounds. While I'm here, I'm going to go ahead and assess for the renal artery, right and left, the aorta, the iliac arteries, right and left, and the femoral arteries, right and left. I'm going to go ahead and concuss the liver borders. And we're going to lightly palpate, looking for any masses, abnormalities, or tenderness. Okay, then we're going to depalpate the liver borders. And check the spleen. And looking for any aortic pulsations. Check the kidneys. I'm going to go across the flank area and depalpate for the kidney. And we're going to do that on both sides. And that concludes my head to toe assessment. Thank you.